I'm Kaylin.
Hi.
How are you?
Good. How are you?
I'm good. Okay, so what is your full name?
Eric Austin.
Okay, and what's your date of birth?
12/14/1981.
Okay. So I go by the pronoun she, her. What pronouns do you prefer?
He, him.
Okay. Any cultural considerations I should be aware of?
No.
Okay. And any medications that you're on?
No.
No? Okay. Any allergies?
Not that I know
Okay. And what brings you into the office today?
of. Just getting a checkup.
Okay. Any history of illness, present illness?
No.
All right. Well, I'm going to be doing a head-to-toe assessment. I'm going to be checking your vital signs. So I'm just going to go ahead and get started with those. If that's okay with you?
Yeah.
Okay, so we're going to start with taking your temperature. Okay, ready? Okay, perfect. Now I'm going to take your blood pressure. Okay, do you have a preference on which arm I use?
My right arm's fine.
Okay, perfect. Okay, let's bring that arm in. Thank you. Let's get that on that artery. Okay, how does that feel?
Good.
Is that good?
Yeah.
Okay, I'm gonna put this thing on. Perfect. Should this thing slide? Okay, perfect. I got you at 135/80. And now I'm going to take your heart rate. Okay, so this. Okay, perfect. So I got your respirations at 12, and I got your heart rate at 78. Okay, perfect. So, 10. Okay, and then, are you in any pain? No pain? Okay. And then I'm going to have you remember these 3 words, okay? The frog jumps. Okay?
Okay.
The frog jumps. All right, so now we're going to be moving on to an assessment of your head. So I'm going to look at your face and your head and your hair. Okay. check behind your ears. See if the mask is irritating behind your ears. I'm gonna check back here. Okay, perfect. Now, I'm gonna have you close your eyes. Okay, tell me when you feel the cotton ball, okay?
Okay. Yeah.
Perfect. Okay, now we're going to check your eyes. Okay, I'm gonna go ahead and look at your eyes. Look at your pupils. Okay, perfect. So, I'm gonna have you look right at my forehead, okay? Good. Keep looking at my forehead. Good. Okay. Alright, so what I'm gonna have you do is look all the way at that door. Okay? And then look at my pen. Very good. Okay. So, please don't move your head, but follow my pen, alright?
Okay.
Okay. Okay. Very good. Now, I'm going to have you close your eyes. We're going to do a nose test. Close your eyes, please, and cover one nostril. Okay, and tell me what you smell.
Sin.
Okay, and cover the other nostril. Tell me if you can smell that.
Mhm.
Okay, and then keep your eyes closed. Okay, tell me if you can hear.
Yeah.
Okay, and tell me if you can. Oh, sorry. Okay, so now we're going to move on to the mouth. I'm going to take a look inside of your mouth.
Okay.
Okay, open your mouth, please. Very good. Okay, now I'm just going to ask you to do a couple things for me. Can you smile, frown, lift up your eyebrows, puff out your cheeks, squint your eyes really hard? Oh, perfect. Okay, so now I'm going to have you yawn, say ah, swallow, gag. Good. And then stick your tongue out for me, please. Perfect. And okay, so that concludes the mouth. So now we're going to do I'm going to check out your neck, look at your carotid artery. Okay, so okay, very good. Just going to take a quick listen. Good. Okay. Gonna do the other side. Okay. Good. So next, oops, sorry. Listen to that one really quick. Okay. Very good. Now I'm going to look for jugular dissension. Okay, very good. Okay, so now we're going to be moving on to listening to your lungs and your heart. So if you go ahead, I'm going to remove this for a second.
Okay.
If you would turn your back towards me, we're going to do some lung sounds. When I press my stethoscope to your back, you just go ahead and take a deep breath in and a deep breath out, okay?
Okay.
Okay, good. 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 And good. Okay, and then if I can have you face me, I'm going to listen to your lungs on your chest. Okay, and same thing, okay? Good. Okay. Good. 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 Okay, now I'm going to listen to heart sounds, okay?
Okay.
we're gonna move on to the abdomen. So I'll grab this pillow. If you go ahead and please lay it down for me. And if you lift your shirt up. So, when was your last bowel movement?
This morning about 7:30.
Okay, awesome. So I'm gonna listen to the 4 quadrants of your abdomen.
Okay.
Good. 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 Sounds like we got some good activity going on. So first I'm going to percuss. I'm going to listen for
Okay.
hollow sounds, okay? Okay, very good. All right, now I'm going to palpate.
Okay.
So I'm just going to be feeling around. Tell me if you have any pain or tenderness, okay?
Okay.
Okay, you good?
Good.
Okay, perfect. You can go ahead and take your shirt down. And we are going to move to your upper extremities, okay?
Okay.
Okay, so first I'm going to look at your arms, see if we have any viscosities, bruising, anything I should be concerned of. Looks good. Looks good. Okay, so I'm going to check for edema on both arms, turgor on both arms. I'm going to check for cap refill on both hands. Awesome. Now I'm going to check your radial pulse. Make sure that they're even. Okay, and if you'd please close your eyes for me. Tell me if you feel this.
Mm-hmm.
Tell me if you feel this. Perfect. Okay. Now I'm going to have you kind of rotate your arms around for me. Perfect. Can you do a little bit of this and this? Very good. Okay, can you squeeze for me? Can you push? Good. Can you pull? Very good. Okay. Okay, so we are going to move to your lower extremities now, if that's okay.
Yeah.
Alright, so I'm going to check out your legs, look for viscosities, hair distribution, both legs. That's good. We're going to do edema on both legs, turgor on both. Good. And then cap refill. Nice. Cap refill. Okay, and I'm going to check your pulse in your foot. Perfect. Good. Do this foot too. Perfect. Okay. Good. And then behind the knees. Okay, good. All right. So next thing we're going to do is I'm going to have you put your feet up like this
Okay.
and down like that. Perfect. Move your knees for me. Move your legs out, kind of like your hips. Show that you can move those hips. Wonderful. Okay. Now I'm going to have you push down them with your feet. Push back. Push forward. Oh, okay. Very strong. All right. So now I'm going to let's put this under you. Get your legs off the ground. Okay, now we're going to do our best to get some reflexes, huh? Good. Okay, good job. Okay, we're gonna try back. Good, all right. Good job. That's awesome. Okay, let's move this out of the way. Okay, so close your eyes, please. Finger to nose. Tap your thighs with your hands. Tap your feet. Very good. Okay, so now I'm going to, if you turn this way, I'm going to pound on your back a little. Tell me if you feel any pain at any point, okay?
Okay. No.
Nope.
No.
Good. Okay, and then I'll have you stand up. And I have you bend forward away from me. Okay, I'm just feeling your spine here. Okay, very good. You can stand up now. Okay, so now we're going to do some walking exercises. I'm going to adjust this. Okay, so what I'm going to ask you to do is walk towards the camera on your tiptoes. Okay, now walk away from the camera on your heels. Very good. Now, if you'd come towards me and stand right in front of me, please. I'm gonna have you close your eyes and just stand still, okay? Okay, keep your eyes closed, but raise your arms up right out in front of you, please. Okay, I'm gonna let go. Okay, very good. Okay, you can put your arms down and you can open your eyes. You can go ahead and take a seat. Okay. What was those 3 words I asked you to remember earlier?
The frog jumps.
Perfect. Okay, very good. So that concludes my assessment. Everything checks out well over here. Do you have any additional concerns?
No.
No? Okay, perfect. Well, it was very nice to see you, and I'll see you in about a year.
All right.
Yeah,
Thank
you'll
you.
schedule an appointment in about 1 year from now,
Yep.
okay?
Okay.
All right, well, I'll see you then.
Okay. Thanks, Caitlin.